Hello everyone and welcome to a new session of clinical pharmacology. Today we are going to speak about endocrine system as an overview before we go in details about in details topics about each organ glands such as the diabetes, such as the ovary, testis, hormones and so on. So today we are going to speak about like overview about the relationship between the hypothalamus, pituitary and target organ tissues. So as you can see here from this slide, we have a list of hormone released from the hypothalamus and interior pituitary gland. This is the abbreviation. We need to familiarize ourselves with these abbreviations. We have GHRH. GH stands for growth hormone. RH stands for releasing hormone. Growth hormone, another name somatotropin. Growth hormone, another name somatotropin. TRH, T for thyrotropin releasing hormone, TSH thyroid stimulating hormone, CRH corticotropin releasing hormone, ACTH work on the adrenocorticotropin. If you look on the what we have in the beginning here, and the prefix we have adrenocorticotropin. Then we have gonadotropin releasing hormone. This is responsible for release of estrogen, progesterone from the ovary and testes. FSH, follicle stimulating hormone, luteinizing hormone, LH, prolactin releasing hormone, PRH, prolactin inhibitory hormone, PIH. Then we have somatostatin. So the question we ask ourselves about what type of hormone will be released from the hypothalamus and what type of hormone will be released from the interior pituitary gland. So from the hypothalamus hormone include GRH, TRH, CRH, GnRH, dopamine, uh, PRH, PIH, SST, oxytocin, vasopressin. And we already discussed the abbreviation for these names here: GRH, TRH, CRH, GnRH, dopamine, PRH, PIH, and so on. What type of hormone will release from the interior pituitary hormone? We have GH, growth hormone, TSH, thyroid stimulating hormone, ACTH, adrenocorticotropin hormone. Then we have prolactin. Then we have FSH and LH, follicle stimulating hormone, and luteinizing hormone, respectively. Okay, this slide here shows the hierarchy and control supervision of the hypothalamus pituitary on the peripheral glands. So you can see here the hypothalamus hormone release several hormones. You can see here we have CR with maybe ending with the RH, growth hormone RH, corticotropin RH, thyrotropin RH, gonads RH, releasing hormone, prolactin releasing hormone, prolactin inhibitory hormone, SST, somatostatin. This hormone, the last two will be inhibitory hormones. The hypothalamus, again, we need to remember that the hypothalamus is considered the place where vasopressin and oxytocin will be synthesized and released from the hypothalamus. So we have two main hormones released from the hypothalamus: vasopressin, oxytocin. These two hormones will be released from the hypothalamus and stored in the posterior pituitary lobe. So please remember that vasopressin and oxytocin released from the hypothalamus and stored in the posterior pituitary lobe. Okay, when the pituitary gland stimulated, this will lead to the stimulation a list of organs in our body. You can see how many organs will be affected, how many glands will be affected by the pituitary gland. The pituitary gland control, stimulate or inhibit a list of hormones there. So you can see here pituitary gland stimulate the thyroid gland, stimulate the breast, stimulate the liver, stimulate the adrenal cortex, 6 organ in male and female, stimulate the uterine to contract under the effect of oxytocin, and the kidneys under the effect of vasopressin. So we are going to speak about all these variables, all these connection between the hypothalamus, pituitary, and target organ glands. Okay, this one here represents the cascade, the axis between the hypothalamus, pituitary and adrenal gland, and you can see how many organ will be affected. We talk about thyroid, we talk about the adrenal, six organs, then we have kidney, uterine, liver, and breast. Again, and they try to remind us from the hypothalamus, we have two main hormones released from there, releasing hormone RH or inhibitory hormone IH. This will stimulate the anterior and posterior hormone, and several organs will be affected. For the what type of hormone released from the hypothalamus, we need to familiarize ourselves with this name of hormone: GRH, CRH, TRH, GnRH, PIH, BRH. And for the interior pituitary lobe, we have list of hormone released from there: GH, ACTH, TSH, LH, FSH, and prolactin. Okay, regarding the thyroxine hormone, thyroid gland, you can see the thyroid gland controlled, supervised by two main organs. The first organ will be the interior pituitary gland, and the second organ will be hypothalamus. Hypothalamus synthesize and release TRH, stand for thyrotropin releasing hormone. The TRH stimulate the synthesize and release of thyroid stimulating hormone, anterior pituitary hormone. This TSH stimulates the adrenal gland to synthesize and release T4 and T3, which is T4 stand for thyroxine, and T4 stand for the thyroxine, and T3 stand for triiodothyronine. So what happened here when we have high level of T4 or T3 in our body? When you have high level of T4, T3 in our body, you can see here these hormone. When you have high level, these hormone practice something called negative feedback on the axis. The T4, T3 will practice negative feedback on the hypothalamus to tell the hypothalamus, I have enough of thyroxine, and T3, can you please stop releasing of these TRH? And they are going to tell the pituitary gland, can you please stop releasing TSH? We call this process negative feedback. And normally we ask for the blood test when we have this maybe patient with abnormalities related to the thyroid gland. We ask for about TSH and T4, T3, and we ask about TSH blood test. So if this is a normal value for the TSH, 0.4 to 4. If you have TSH high or low, this may diagnose hyperthyroidism or hypothyroidism. Okay, we discussed the first one related to the thyroid gland. What about adrenal cortex here? As you can see, adrenal cortex supervised and controlled by the hypothalamus. The hypothalamus releasing the CRH, corticotropin releasing hormone. The CRH stimulate the anterior pituitary. The anterior pituitary will stimulate, synthesize and release ACTH. ACTH will stimulate the adrenal cortex to release three hormones. From the adrenal cortex, we have cortisone, the main hormone, followed by aldosterone and androgen. Again, we use ACTH normally for diagnostic purposes. As you can see here on this chart here, you can see ACTH blood test. We have normal value. What happened if the ACTH was high? When we have ACTH with a high level, this may indicate Addison disease. This may indicate adrenal hyperplasia. This may indicate a tumor somewhere, multiple endocrine neoplasia, a tumor. Also, when you have ACTH high, this may indicate Cushing disease. Could be related to the primary, or could be related to some tumor releasing ACTH, such as pancreas, lung, or thyroid. Okay, next hormones will be growth hormone. As you can see here, the growth hormone released from the anterior pituitary, and the growth hormone will be controlled by the GHRH, growth hormone releasing hormone. GHRH stimulate growth hormone. The growth hormone will affect the specific type of receptor on the target tissues called insulin-like growth factor, IGF-1. The target organ for the growth hormone will be bone, will be muscles, will be the liver, will be the bone tissue. So we have so many target organs for the growth hormone: liver, bone, muscle, adipose tissue. Again, also here we have something called negative feedback. We need to remember the growth hormone release in our body, in human body, in volatile manner. That means the growth hormone will be high during sleeping, especially talking about children. But with increasing age, the growth hormone will be decreased, and this will associated with a decreased lean muscle mass. We asked sometime when you have any suspicion about the growth hormone, about the development of the children. We ask about the growth hormone blood test. So we have it in male and female and children, different age. So you can see here in adult male we have some values. Adult female a little bit higher, and children they give you different value according to the age and gender. If the growth hormone is high, so if the growth hormone level is high, this may indicate acromegaly, gynecomastia, acromegaly in adult and gynecomastia in children. Sometimes we have some cases, rare case like GH resistance or tumor in the pituitary gland. So this is a high level of growth hormone indicated acromegaly, gigantism. What about low level? This would indicate the slow growth in children and infant, or may cause dwarfism. Okay, this slide here represent the prolactin. The prolactin released from the anterior pituitary, but you can see here the prolactin under supervision of two hormones released from the hypothalamus. So the first hormone will be TRH. TRH stimulate the prolactin. Dopamine inhibit the prolactin. So we have a balance in the prolactin in our body because we have two main hormones released from the hypothalamus. The first one, TRH, stimulate, another one, dopamine, inhibit. So if the prolactin stimulated, the prolactin will stimulate the breast to produce milk, and the dopamine will inhibit the prolactin, and this will decrease the producing of milk from the breast. We have normal value for the prolactin. If you ask for blood test for prolactin, if the prolactin high, we call the case hyperprolactinemia. So when you have prolactin high, we call this case hyperprolactinemia. Normal level in male, you can see it like 20 nanogram per milliliter. Speaking about female, 25. Non-pregnant. What about pregnant or breastfeeding? You can see the value between 80 to 400. So 20 in male, 25 in female, non-pregnant. Pregnancy and breastfeeding, 80 to 400. What happened when if you have high level of prolactin? We call this case hyperprolactinemia. The patient may suffer from infertility. The patient may suffer from amenorrhea, galactorrhea. If you talk about male, we can see some case of erectile dysfunction and gynecomastia. The main cause of hyperprolactinemia, the most common cause, will be tumor in the pituitary gland, prolactinoma. So prolactinoma or tumor in the pituitary gland, this is the most common causes, but we need to exclude medication or other cases. Okay, this will summarize the information about the endocrine system. As you can see here, we like a summary, not everything in the slide, but this is the main hormone, the main relationship between the hormone, GH, growth hormone. So for the GH, we need to answer the question: which hormone will control the GH? GHRH released from the hypothalamus stimulate growth hormone. Which hormone inhibit the growth hormone? We have somatostatin. Where is the location of somatostatin secretion? Will be the hypothalamus. So these two hormones control the growth hormone synthesized and released from pituitary gland. The target for growth hormone will be liver, bone, muscle, kidney, and other tissue. Which target hormone will be affected by growth hormone will be insulin-like growth factors, IGF-1. Moving to the thyroid gland. Thyroid gland we have controlled by the hypothalamus by TRH. TRH stimulate TSH. TSH stimulate thyroid. We call this hierarchy, we call this one axis from the hypothalamus pituitary target organ. And you can see here the thyroid gland responsible for release, synthesis and release of thyroxine, triiodothyronine. Moving to the next, adrenal cortex. Here, adrenal cortex under control of CRH. CRH stimulate ACTH. ACTH stimulate adrenal cortex. Here we see only cortisone, but we need to add androgen and aldosterone. It's not only cortisone from the adrenal gland, but cortisone will be the main hormone released from the adrenal cortex. But we have two other, maybe aldosterone and androgen. What about the gonads, the ovary and the testes? The ovary will be controlled by the GnRH and FSH-LH. So the GnRH stimulate FSH and LH, and this will stimulate the ovary or testis and to release the estrogen, progestin, and testosterone. The last one here, you can see it. We have the breast, we have dopamine. Then dopamine inhibit prolactin. If the prolactin is high, the prolactin will be stimulate the breast to produce milk. But if you talk about dopamine inhibit prolactin, so decrease breast discharge, breast milk discharge. Okay, this will conclude our brief introduction to the endocrine system. Our next lecture will be focused on the endocrine or hormones separately. For example, we are going to speak about the hypothalamus hormone in details, about the pituitary gland in more details, about the thyroid gland in details, about the function, hormones, medication, how this medication work, clinical use, side effect for each medication belong to the thyroid gland. Then we are going to speak about the diabetes and so on. Thank you for listening and have a good day, everyone.